Good morning. Adult CPR or basic life support. See, patient is responding or not or unresponsive. If patient is unresponsive or not responding, so call by name or shout for hello sir. Are you okay? Is not responding. So tap the chest 3 times. Still not responding. So immediately check the carotid pulse with the 3 fingers. Less than 10 seconds you want to check. There is no pulse. So immediately you activate code blue or call for help. How to activate code blue? Dial 7777. Say 3 times exact location like 7th floor, bed number 701. Receptionist 3 times she will announce. Code blue team, emergency doctors will come with the defibrillator. So same time who's announced code blue or who seeing patient is unresponsive, that person start the CPR. So how to start CPR? First position. So take the patient nearby you. Your chest is straight. Your both hand keep straight. Then keep your both hands heel below the sternum. Interlock your hand. Then compression. 30 compression. Each compression should be 1.5 to 2 inch depth and allow to chest recoil. So start compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So like 30 compression. In 1 minute, at least 100 to 120 compression you have to give. In case you had any help, so after 30 compression, they are giving 2 rescue breath. How they give 2 rescue breath? First, mask position. So your position in the head side, stand in the head side, keep the elbow back like this, and your C clamp with the C technique and E technique, at head tilt and chin lift. Then 2 breaths. 1, 2. Restart CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9. Like 30 compression. Then 2 breaths. Within minute, 100 to 120 compression. Then after 1 minute, you recheck the pulse. If there is pulse, shift to ICU. If there is no pulse, then restart the CPR. Thank you.